one potential mistake from caregivers is to try to reorient to reality the facts that are actually occurring, as opposed to just empathizing with what the patient is saying. So if you're confronting them with reality, they may disagree because their reality is a little different. They may get angry, upset, focused on you. It's not very good caregiver-patient relationship, because you have to do so much to help them, and then you get burned out more. So one of the techniques we usually suggest is, for example, just empathize. It's terrible that someone took your toenail clippers. Mom will take a look around for them. Thank you for telling me. As opposed to, come on, Mom, who would take a pair of used toenail clippers? You got your jewelry and your TV. No one's come into the house to take some toenail clippers, right? And so you empathize. Yeah, that would be terrible if your neighbor did that, or that would be terrible if you misplaced something. We're going to look for that, and we'll work together on this. And it eases them. You're on their side. You're not putting them down. You're not bossing them. Another thing for bossing is when you have dementia, you forget to do things. So you got to get dressed now because we got this appointment in 2 hours. You got to plan ahead. They're not planning ahead. Maybe you should take a shower. You wore that yesterday. You should change this. All these little tiny things. So then you're saying, do this, do that, do that. And people become very defensive. You quit telling me what to do. No one likes to be bossed to that extent, right? So instead, we often tell the caregivers things like, I'm going to get dressed now for the appointment. Did you want to get dressed as well? To give them clues so that it's not sort of a bossing them, it's sort of an asking in a, directed way.